Hello and welcome to Pill to Purpose, the channel where we break down what your medicines really do in simple, easy to understand words. Today, we're diving deep into one of the most widely prescribed medicines in the world, Metformin. If you or someone you know has type 2 diabetes, you've almost certainly heard of it. But what exactly is it? How does it work? And what should you know before taking it? Stick around as we cover everything you need to know. First things first, what is metformin? At its core, metformin is an oral medication, meaning you take it by mouth, and its main job is to control high blood sugar. It's the first-line treatment for most people diagnosed with type 2 diabetes. Metformin belongs to a class of drugs called biguanides. Think of it as the foundational stone for managing diabetes for millions of people worldwide. It's been around for decades and has a long track record of being both safe and effective. So, how does this popular pill actually work its magic? Metformin has a clever, multi-pronged approach to lowering blood sugar. It works in three main ways. First, it tells your liver to calm down and produce less glucose. Your liver naturally makes glucose, but in people with diabetes, it often makes too much. Metformin puts the brakes on this overproduction. Second, it improves your body's insulin sensitivity. Insulin is the key that unlocks your cells to let sugar in for energy. With type 2 diabetes, your cells become resistant to insulin. Metformin helps make your cells more responsive to the insulin you already have, so your body uses it more efficiently. And third, it reduces the amount of sugar your body absorbs from the food you eat. So, even if you have a meal, less of that sugar makes its way into your bloodstream. A huge advantage of metformin is that when it's used on its own, it doesn't typically cause your blood sugar to drop too low, a condition known as hypoglycemia. This makes it a much safer option compared to some older diabetes medications. Now, let's talk about the many uses and medical benefits of metformin, which go beyond just diabetes. Its primary and most well-known use is, of course, controlling type 2 diabetes. By keeping your blood glucose levels in a healthy range, it helps prevent the long-term complications of the disease, like nerve damage, kidney problems, and vision loss. But did you know it can also be used to prevent diabetes? For individuals with pre-diabetes, where blood sugar levels are high but not yet in the diabetic range, doctors might prescribe metformin to help prevent or at least delay the onset of full-blown type 2 diabetes. It gives your body a fighting chance to get things back on track. Another interesting benefit is its effect on weight management. While it's not a weight loss drug, many people who take metformin experience a mild reduction in appetite, which can lead to modest weight loss over time. This is a welcome side effect for many, as weight management is a crucial part of controlling type 2 diabetes. Beyond diabetes, metformin has found a significant role in treating polycystic ovary syndrome, or PCOS. PCOS is a hormonal disorder that can cause irregular periods and fertility issues in women. Metformin helps to improve insulin resistance, which is often a key factor in PCOS, thereby helping to regulate menstrual cycles and improve the chances of conception. Finally, by controlling blood sugar and helping with weight, metformin also plays a role in protecting your heart. High blood sugar can damage blood vessels over time, increasing the risk of heart attacks and strokes. By keeping glucose in check, metformin helps lower these cardiovascular risks, making it a heart-healthy choice for many. Of course, like any medicine, metformin does have potential side effects. The good news is that for most people, they are mild and tend to go away on their own after a few days or weeks as your body gets used to the medication. The most common side effects are related to your digestive system. You might experience some nausea, an upset stomach, diarrhea, or a strange metallic taste in your mouth. Some people also report a mild loss of appetite. A simple but very effective tip to minimize these issues is to always take metformin with a meal. Taking it with food helps buffer your stomach and can make a huge difference in your comfort. If you're on an extended release version, the side effects are often even milder. So don't be discouraged if you have some tummy troubles at first. They usually don't last long. While common side effects are usually manageable, it's crucial to be aware of a very rare but serious side effect called lactic acidosis. This is a medical emergency. Lactic acidosis is when lactic acid builds up in your bloodstream faster than it can be removed. The risk is extremely low, but you need to know the warning signs. If you ever experience extreme weakness, unusual muscle pain, severe stomach pain, difficulty breathing, or feel very dizzy, lightheaded, or cold, you need to seek emergency medical help immediately. It's important to stress that this condition almost exclusively happens in people who have other serious health problems, like severe kidney or liver disease, uncontrolled heart failure, or those who are severely dehydrated. For the vast majority of healthy individuals taking metformin as prescribed, the risk is incredibly small. So, this brings us to the question: who should be cautious with metformin or avoid it altogether? It's not the right medicine for everyone. You should never take metformin without a doctor's supervision, especially if you have certain pre-existing conditions. People with severe kidney disease should not take it because the kidneys are responsible for clearing metformin from the body. If they aren't working well, the drug can build up to dangerous levels. The same goes for those with serious liver problems. If you're suffering from severe dehydration, from something like a bad stomach flu, your doctor might advise you to temporarily stop taking it. Heavy alcohol use is also a major red flag, as it significantly increases the risk of lactic acidosis. People with uncontrolled heart failure should also avoid metformin. Lastly, if you are scheduled for a surgery or an imaging test that uses contrast dye like a CT scan, your doctor will likely tell you to stop taking metformin for a couple of days before and after the procedure to protect your kidneys. To make sure your experience with metformin is as safe and effective as possible, let's go over some simple safety tips. First, and I can't say this enough, always take your dose with a meal. This is the #1 way to prevent stomach upset. Second, stay well hydrated. Drinking plenty of water throughout the day helps your kidneys do their job of filtering everything properly. Third, if you are taking an extended release tablet, which might have letters like XR or ER in its name, you must swallow it whole. Never crush, chew, or break these tablets, as it will release the entire dose at once, defeating the purpose of the slow-release design and increasing your risk of side effects. Fourth, regularly monitor your blood sugar levels as advised by your doctor. This helps you and your doctor see how well the medicine is working and if any adjustments are needed. And finally, always keep your doctor in the loop. Inform them about all other medications and supplements you're taking, and remind them you're on metformin before any surgeries or medical tests. And as we mentioned, avoid excessive alcohol consumption while on this medication. In conclusion, metformin is a cornerstone of modern diabetes treatment for a reason. When taken correctly and under medical guidance, it remains one of the safest, most effective, and most affordable medicines for managing type 2 diabetes and its related conditions. It works in multiple ways to lower your blood sugar, offers protective benefits for your heart, and can even help with other conditions like PCOS. While it does have side effects, they are typically mild and manageable for most people. The key is open communication with your healthcare provider to ensure it is the right choice for you and to manage it safely. We hope this video has helped demystify metformin and given you the confidence to understand your treatment better. Thank you for watching Pill to Purpose. If you found this information helpful, please give this video a thumbs up. Subscribe to our channel for more simple guides on medication and share it with anyone who might benefit. Your support helps us continue making medicine easier to understand for everyone. Stay safe, stay informed, and we'll see you in the next video.